Good afternoon, and thank you all for joining us for this important discussion on the opioid epidemic and the current trends that have become prominent over the course of the last year through this global pandemic. I'm Lauren Sisler, a sports reporter and also board member at the Addiction Prevention Coalition. So it's my honor to be here discussing this topic with you all today. I'll be moderating today's webinar alongside Dr. Darlene Traffanstedt. I am really looking forward to the information that she's going to share. She's given us a little glimpse into what she'll be sharing with us today about the current numbers and trends that are specific to Jefferson County, but certainly consistent with the trends that we are seeing nationwide right now. So before I introduce to you Dr. Traffanstedt, I would like to encourage all of you guys to hop into the chat function there and ask questions throughout the presentation. And then we'll save the last 10 minutes or so to answer those questions. And of course, if any questions come up directly, we'll have folks there in the chat room as well, being able to provide resources and links to various things there. So without further ado, Dr. Traffanstedt joins us today. She also goes by Dr. T, but we'll interchange it up a little bit here. So Dr. Traffanstedt joins us today as the medical director at the Jefferson County Department of Health. She's a native of Florence, Alabama. She completed her undergraduate degree at Alabama and her medical degree at the University of Alabama School of Medicine. In addition to her role as a medical director, she serves and has served on several boards, including the Alabama Board of Medical Examiners, the State Committee of Public Health, and is currently co-chair of the Prescribers and Dispensers Committee as part of Governor Kay Ivey's Alabama Opioid Overdose and Addiction Council. And with that, we'll start with a quick overview of today's presentation. Dr. T, thanks for joining us so much. We appreciate it. And I want to start by asking you, why is it so urgent that we're having this conversation today as we have turned the page over to 2021?
Well, thank you so much, Lauren, for that introduction. The key takeaway that I want people to have from today is that fatal and non-fatal overdoses are at an all-time high here in Jefferson County, in Alabama, and in the United States. And the pandemic has had a great effect on that. And we want people to know what's happening in our drug supply and why people are overdosing at a greater rate and what resources are available to them in the community.
Yeah, and what are some key takeaways that you hope our viewers will take with them and take with them later today, those that are watching currently now? And of course, this will be available on demand and later on the APC Facebook page that people can, take with them and take some notes and be able to apply down the road, and obviously perhaps share with those, friends, family, loved ones, and people that would be interested in this information.
Sure. So illicitly manufactured fentanyl is the major cause for the increase in drug overdoses that we're seeing in our community and nationwide. And it has permeated all street drugs here in Jefferson County. So if it's bought outside of a healthcare provider's office or a pharmacy, there is a chance that it contains fentanyl and it can be deadly. There is a drug overdose reversal drug that is available for free in the state of Alabama, and we want people to know where to get that. And we want people to know where to get treatment and recovery resources if they need them.
Outstanding. Definitely looking forward to the presentation. And before we hand things off to you, I do want to remind people that you can get involved by joining us for the End Heroin BHAM 16.6 challenge. It's a little different this year. Things are we're going to challenge you quite a bit. 16.6 being the rate of death by overdose here in the state of Alabama. The challenge is kicking off this Friday and will run through the remainder of April. We'll detail more information at the end of today's webinar. You can also find more info on APC's Facebook page and website. We'll also drop a link there in the chat function so you can go on there, register yourself, your team, whomever, and join us in this awesome challenge that the Addiction Prevention Coalition is putting on as their annual End Heroin BHAM walk. So still plenty of time to register and to get involved. And with that, Dr. T, I'll turn it over to you.
Okay, thank you, Lauren. I'm going to share my screen. So let me get started with that. So we're going to start today by talking about the pandemic effect on overdose data and overdose rates. And we're going to start with the national view and then work our way down to the state level and the county level. So this slide represents what's happening at the national level. And what I want you to see is what I am circling here with the red laser pointer, and that is the pandemic effect on overdoses at the national level. So in January of 2020, we started to see a significant rise in overdose deaths, and that rise persisted throughout the year 2020. And some data that I will show you later shows that the beginning of 2021 is actually even worse. All right, so this map that you'll see here is a map of the United States, obviously, and it shows states that have had a decrease or increase in overdose deaths from the 12-month period from August of 2019 to August of 2020. And this is the most recent 12-month period for which data is available from the CDC. As a country, our overdose deaths increased by 25.1% from that August 2019 to August 20 over the previous 12-month period. Alabama is right in the middle of the pack at 26.5%. And the worst, I guess, state or territory would be the District of Columbia, which had a increase of 57.9% in overdose deaths from August of 2019 to August 2020. So you can see that North Carolina, North Carolina, Montana, and North Dakota are the states that actually saw a decline in overdose deaths. North Carolina has had a very proactive public health approach and an opioid action plan. And there is the possibility that there is a data lag in some of these states as public health has been dealing with the COVID-19 pandemic and also is the entity that handles overdose data. So for the 12-month period that ended in August of 2020, we lost 85,516 Americans to drug overdose death. And that is by far the highest number ever reported. You may have seen some public reports from the White House that have come out in the last week about this number and really raising everyone's awareness of this issue. And they are reporting the 88,000 number that you see on this slide, which is predicted to be the final number once all of the data collection has been completed. So we're losing 234 Americans a day if you use the 85,000 number, and we know that that number is likely going to grow. So if you think about that in terms of major disasters here, every 11 days, we lose as many people to drug overdose death as we lost in the 9/11 terrorist disaster. So that just gives you an order of magnitude of what's really happening here in our country. So this is the Alabama data. And what I want you to note is that Alabama's curve looks very similar to the national curve. So we are seeing the same rate of increase since the onset of the pandemic that we're seeing at the national level. And these are provisional year-end numbers for Alabama. So in 2019, we lost 739 individuals to drug overdose in Alabama. And the preliminary number for 2020 is 890. And we know that that number won't go down, but that number will likely go up as all of the final data is collected. 881 of those 890 individuals were Alabama residents. We are also seeing an alarming shift in the demographics of drug overdose deaths in our county and in our state. And I wanted to point that out to you all here. So in 2019, we lost 92 Black or other ethnicity males, non-white males. And in 2020, we lost 164. And so that number almost doubled. And the same for non-white females. We lost 37 in 2019 and 55 in 2020. And so this is certainly something that we're keeping an eye on in public health to try to understand what's happening to cause that change and to cause us to lose more of those individuals. This slide demonstrates the difference in fentanyl-involved deaths that we saw here in Alabama in 2020. So if you look at the square highlighted in red right here, you'll see that in 2019, we lost 174 Alabamians to, 174 overdose deaths occurred in Alabama related to fentanyl, and that number rose to 363 in 2020. So it's really clear from all of the data that we'll look at today that fentanyl is driving the increase in overdoses, fatal and non-fatal, that we're seeing here in our state. This slide reflects the top drug causes of overdose in Alabama over the last several years. And in 2019, the leading cause of drug overdose death in Alabama was methamphetamine. And in 2020, it is fentanyl. Now we're down to the county level, and Jefferson County is obviously Alabama's most populous county. And so unfortunately, we have the distinction of having the most drug overdose deaths of any county in the state. And this is our 2019, 2020, and the first quarter of 2021 data in the table to the right. Historically, you'll see over here to the left that over the years of 2000 to 2017, and 2017 was the peak in drug overdose deaths prior to 2020. So we had 269 Jefferson County individuals that we lost to drug overdose in 2017. There was a lot of effort put into intervening in this issue. And in 2018, we saw a slight decline. That was reversed in 2019. And then in 2020, it just really rose again. So we lost 296 individuals to drug overdose death in Jefferson County in 2020. And we've already lost 66 thus far this year. And that's for the first quarter. And that is only confirmed deaths. And we know that number will also rise as death investigations are completed. 73% of the overdose deaths we've seen in Jefferson County this year are fentanyl involved. And that number is reported as high as 80% in other parts of the country. We have a lot of data about 2020, but obviously it's very early in 2021. And so our data is limited. But I want to show you something that's very alarming to us. And one of the reasons why we're trying to get this messaging out as broadly as possible. And that's what you see right here. So every day we receive several data sets about overdoses. And one of those data sets that we receive is how many times EMS was called for a suspected overdose. And in the month of February, we had 171 EMS calls here in Jefferson County for suspected overdose. And that number rose to 330 in the month of March. And so I mentioned earlier that the 2021 numbers are not looking good, and this is just one of those data points. This is CDC data reflecting ER visits or emergency room visits for overdose for the year, for the height of the pandemic. So you'll see that these graphs are from March of 2020 to September of 2020. And the blue bars are 2020 numbers and the orange bars are 2019. And I don't want to spend a lot of time on this, but just to note that these are heroin overdose ER visits. And you'll see how much higher the blue bars are in 2020 than 2019. And the same thing is seen for opioid overdoses, and most of these are fentanyl. Here's our stimulant numbers, and then this is our all drug numbers. So you can see that the heroin and opioid overdoses are driving the majority of the increase. This is our Jefferson County Emergency Department data. So in March, we saw 35% more emergency room visits in Jefferson County for overdose than we saw in February. And this is just another one of those data points that makes us very concerned about what's happening. On average, we see 8 emergency department visits a day in the county for overdose in the month of March. This is just a graphical depiction of what I showed you previously, and it just shows the upward curve that we're seeing. So this is height of the pandemic last year, and then we initially thought there was going to be some reprieve here in late summer, early fall, but since that time, we're really just climbing continuously. This orange line that you see here is data that we receive from the Jefferson County Coroner Medical Examiner's Office on a daily basis. So each day they send us a number of death investigations that they are working on that are suspected to be drug overdoses. And we get a zip code for those so that we can really look at hotspots in the county and places that we need to send resources. And in February, we had 17 provisional overdose deaths sent to us by the coroner medical examiner's office. And in March, that number rose 141% to 41. So just again, stressing how important it is that we get resources out to the community. So fentanyl, we've proven that it's driving what's happening in our community and at the state and national level as well. And this is just 3 recent stories that were published on AL.com. So in January in Brookside, a really small town in West Jefferson County or Northwest Jefferson County, they seized a kilogram of fentanyl. And fentanyl is dosed in micrograms. So I put this little picture in here to show you. A microgram is this little speck, and a kilogram is this big bucket. And so if you can imagine how many people would be killed with a kilogram of fentanyl. And this is not just happening once, this is happening all over our state. It's really, really a major problem. We had a Jefferson County sheriff's deputy that was exposed to fentanyl during an investigation, and her overdose, accidental overdose via occupational exposure, was reversed with Narcan. This just happened a couple of weeks ago. And then last week, sadly, we lost 3 women in one apartment complex on the eastern side of the county within 8 hours to overdose, to suspected overdose. So again, just driving home the point that we're really struggling. So I think there's, a lot of people hear the word fentanyl, but don't really understand what fentanyl is or why it is such a big deal. And it is a synthetic opioid. And all that means is that it's not derived from a plant. So morphine, heroin, cocaine, marijuana, all come from plants. But fentanyl is made in a lab, and it's made by chemists, and it can be easily made in a lab, in a clandestine lab, by individuals with very little training or education. It is a Schedule II narcotic in the United States, and it binds to the opioid receptors in the brain that relieve pain. So it binds to the same receptors that heroin, morphine, Lortab, Norco, Percocet, OxyContin, it binds to those same receptors. But what it does, it depresses the respiratory drive and the cough reflex when it oversaturates those receptors. So in people who are not tolerant to opioids or who are not being closely monitored in a healthcare setting, there is a very narrow therapeutic window between relieving pain and a fatal overdose. It does come in a prescription version, and we're going to cover that briefly, but the majority of the overdoses that we're seeing right now are illicitly manufactured fentanyl, manufactured in clandestine labs. And it is significantly more potent than heroin or morphine, which speaks to that narrow therapeutic window that I mentioned earlier. So prescription fentanyl is typically used for 2 reasons. It's typically used to relieve severe pain, like cancer, metastatic cancer pain, or it is used in the perioperative setting, which means it can be used to induce anesthesia in the operating room, to maintain anesthesia in the operating room, or to relieve acute postoperative pain in the recovery room. The patients that use it for cancer pain or other severe forms of pain are typically opioid tolerant, meaning that they've been on other types of opioids for an extended period of time, and now they've reached the point in their disease process that they need a more potent opioid. And those patients can tolerate small doses of fentanyl because their body is used to opioids. For patients in the perioperative setting, they are monitored very closely. Their respiratory rate, heart rate, and oxygen saturations are all monitored. And those are really the only appropriate uses for fentanyl. There are some other FDA-approved drugs that are like fentanyl, one of which has entered our illicit drug supply, and that's carfentanil. So carfentanil is a large animal tranquilizer. It's used in horses and sometimes cows, but it is not approved for human use. And we are aware of a 2-kilogram bust here in the state of carfentanil, which would have been enough to kill, again, a large number of Alabamians. Sufentanil is a drug that's been developed with the U.S. military to be used for severe battle trauma. And again, haven't yet documented that it's present in our illicit drug supply, but there certainly is the possibility that it could be. So here's a comparison chart of lethal doses of opioids, and I think it's a really good visual. So a lethal dose of morphine is going to be about the size of an English pea. A lethal dose of heroin, or a fatal or deadly dose of heroin, is going to be about the size of a sunflower seed out of its shell. A lethal dose of fentanyl, which is going to be approximately 100 times stronger than morphine, is going to be the size of a sesame seed. And these two more potent opioids that I just mentioned, especially carfentanil, which we have documented that it's in our illicit drug supply, is half a grain of salt is a lethal dose. So these last three, fentanyl, sufentanil, and carfentanil, are extremely potent opioids where a tiny dose, a microgram dose, can be lethal. So illicitly manufactured fentanyl, we've mentioned it's produced in these clandestine labs and often comes into the United States from China or Mexico in its precursor form. So they'll send through the mail or through a shipping channel, they'll send the chemicals that are needed to make the fentanyl product. And so it's very difficult for law enforcement to detect when it comes into our country. It's very cheap. The precursors are cheap, it's cheap to produce, and it's easy to produce, as I mentioned earlier. And one of the things we've really seen lately is that fentanyl is illegal to produce outside of an FDA-approved situation. So what the creators of these drugs have been doing is they've been slightly modifying one portion of the chemical formula and producing fentanyl analogs, which then the federal government has to go through the scheduling process for them, and it takes some time. So while that process is going on, technically it's not illegal to produce or dispense those substances. So they're really trying to get around our legal system by being creative with their chemistry, all the while killing people with the drug. The dark web is highly involved in the trafficking of illicitly manufactured fentanyl. Cryptocurrency also highly involved in this process. You'll usually find it in powder form, but they are purchasing pill presses. So I apologize for sirens. They are purchasing pill presses and taking that powder form and making counterfeit pills, which look just like prescription medications. You can barely tell the difference between them and a prescription medication that you would get at the pharmacy. It's in our heroin supply, and it's more recently in our cocaine supply and our methamphetamine supply. So if you purchase a drug outside of a healthcare provider's office or a pharmacy, at this time, there is a significant chance that there could be fentanyl in it, even if it looks like a legitimate prescription drug. This slide is from the DEA, and it's basically just showing how illicitly manufactured fentanyl is getting into the United States. So it comes from China to Canada, from China to Mexico, and then from Canada into the United States, from Mexico into the United States, and directly from China into the United States. This slide is from 2019, so this is pre-pandemic. And what we know about the pandemic is there's more fentanyl here, but we don't know how the pandemic, at this time, we're not fully aware of how the pandemic altered what we see on the slide. So we know when the pandemic hit China that a lot of things shut down in China. We know the US-Mexico border closed early in the pandemic. So what happened in the United States that caused there to be more illicitly manufactured fentanyl produced if it had trouble getting here from the two major places that it typically comes from? And hopefully we'll know more about that and in the near future as we examine, kind of look back on what happened during the pandemic. So I've not given you a lot of great news today, but I want to end on hope. And I want to ask you, in all of your spheres of influence, whether that be your community, your fraternity, sorority, your church, your workplace, your neighborhood association, alumni associations. So wherever you have influence, please help us spread the word that this is what's happening in our community. We know that youth are purchasing counterfeit pills. We know that those are being sold on Snapchat. We know they're being sold in libraries as students prepare for finals. And it's just really critical that people understand what's in our drug supply and what could happen if you purchase a pill that you think is a legitimate prescription, or if you purchase any drugs on the street. And the hope comes in two ways. So fentanyl overdose deaths are preventable. They are reversible. And they're reversible with a drug called naloxone or Narcan. And the pandemic forced us to develop creative ways to get Narcan into the community. And it really has been a blessing in disguise, because now we have developed an online Narcan training system available on our website at the web address that you see on this slide. So www.jcdh.org/naloxone. Individuals can get Narcan training anonymously and receive a free Narcan kit through the mail in a nondescript white box that doesn't let anybody know that you've requested or accessed Narcan. They can pick it up at one of 17 pharmacies in the Jefferson County area, and we're continuously trying to expand that number to more. Or they can come here and pick up a kit in a drive-through fashion. We actually meet people in the parking lot and pass off the kits if they need it urgently or can't wait for it to come in the mail. So we really want people to take advantage of this. It is available to anyone in the state of Alabama. So you don't have to live in Jefferson County to take advantage of this resource. We partner with the Alabama Department of Mental Health. So Jefferson County Department of Health provides the kits for our residents, and the Alabama Department of Mental Health provides the kits for the rest of the state. We do have 3 events coming up, one of those in partnership with the Addiction Prevention Coalition on June the 18th at Lynn Park, and also celebrate Hoover Day coming up on April the 24th, and the Creek Bank Festival in Leeds on May the 15th. So we'll be there, our team will be there in person, and we'll actually have peers, individuals who are living in recovery, who are there to help people who may be struggling with substance use. And we'll have a substance use assessor with us who can actually on site do the assessment that would be required to get someone into a state-sponsored treatment program. So I encourage you, if you need any of these resources, please take advantage of them, and all of them are free. And lastly, the hope of treatment and recovery. And I think for me, that's one of the most important things to say, is that there is hope, and recovery is possible, and there are people living full and wonderful lives in recovery. And many of those individuals choose to serve as certified peer recovery support specialists. And you can access a certified peer recovery support specialist 24 hours a day, 7 days a week through the 24/7 substance use helpline. And I've listed that number here on the slide. We also have the Recovery Resource Center here in Jefferson County, currently housed at Cooper Green Hospital and available via teleservices. So you can have a telephone call with a peer. You can actually have a full substance use assessment over the telephone, and they will help navigate you to treatment and recovery resources. So we know addiction is a chronic disease, and it requires a treatment plan and healthcare professionals to help navigate that chronic disease. And all of these resources that I've mentioned to you today are available for free and open to anyone in the state of Alabama who may need access to them. And lastly, I just want to give you my contact information. We are here to help. This is an issue very near and dear to Dr. Wilson, our county health officer, and to our team here. And we're working in partnership with many state agencies and local agencies and partners like the Addiction Prevention Coalition. And so please reach out to us if there's anything that we can do to serve you. My telephone number is here and email address. And just want to say a special thank you to the Addiction Prevention Coalition for allowing me to present this information to you all today.
Thank you so much, Dr. Traffanstedt. We really appreciate all the great information that you provided. And we just want to encourage you all to jump in and ask questions. We would love to hear from you all based on this information that she provided today. Very good, in-depth information. I'm sitting here trying to process it myself. I've been jotting down notes this whole time, and of course, kind of going through your slides and whatnot. And maybe that's even something you could, provide as well, a couple of slides that will be beneficial with some of those numbers and statistics. I guess one thing, kind of off the top as we get into sort of the Q&A portion of this, and again, please feel free to jump in and ask questions, as you see fit. And, I think the first thing I would want to ask is, what do you believe to be some of the largest contributing factors to this uptick? Obviously, during the pandemic, we've seen a multitude of challenges, a lot of the isolation, people not really being able to maybe access resources. But what would you say some big contributing factors to this are that people need to be aware of that can be maybe a catalyst for a lot of these overdoses and what we're seeing in these current trends?
So early in the pandemic, all of the ways that we provided services to those struggling with substance use had to change. And it just took all of us time to adapt to the new way of doing things. So social distancing and, all of our trainings prior to the pandemic had been in person, small group trainings or in heroin BHAM walk trainings, large group trainings like that. So everything about how we approach this problem in public health had to be modified. And it just took a little bit of time for us to make those modifications and adjustments. Treatment capacity was reduced. Treatment centers had to socially distance as well. And so we know that in some cases, treatment capacity was reduced by 50%, which means that people that wanted to get into a treatment situation may not have been able to access the treatment that they needed based on their situation. We know that when the Mexico-US border closed, that heroin could not come into the United States at the same rate that it had been. And so the pharmacology, the chemistry of the drug shifted so that, the heroin supply had more fentanyl, less heroin than it had before, which made it more potent and deadly. So, once we're able to fully get out of the pandemic and look back, I think we'll see some other things that maybe we have not identified yet, but those are the major things that we've seen.
And I guess kind of going off of that, based on what we've had to change about sort of our way of living, and obviously, providing, care for people that are, struggling with substance use disorder and struggling with addiction. Are there things that are in place that perhaps through the pandemic that maybe have altered the way things will be done specifically? Or do you see things kind of transcending back into the way things were before, as we kind of move to the back end of this pandemic?
Well, I know the online access to Narcan will persist, and I'm so grateful for that and all of the individuals that helped us get that up and running. But I feel like most of us believe that, especially with a sensitive issue like this, that face-to-face contact is definitely preferable to Zoom, contact or telephone calls instead of face-to-face. And so I do believe that as soon as it's safe, most substance use services will go back to face-to-face, small groups, those kinds of things, and still being as safe as possible. But I believe that personal touch really makes a difference.
And I guess, we talk about this a lot, especially at the Addiction Prevention Coalition and a lot of the different webinars that we do. And, the APC is always posting different things on their website. And of course, the Facebook page and on social media, things to look out for, things to be aware of, signs and symptoms. What are some things that you can share with us in terms of what to look out for if you think a loved one is struggling with addiction or substance use disorder, if you think that this could be, a problem within your circle of family, of friends, your community? What should people be on the lookout for, and what should be their next steps if they do in fact suspect that?
Yeah, so I think we just have to open up the lines of communication and not be afraid to talk about it. Or, I think the other thing that really limits people from helping people get to resources is stigma, and a lack of recognition of addiction as a chronic disease. And so opening up those lines of communications, especially with your adolescents and teens and college students. Those are the ages where we really see this problem take off. And we know there are counterfeit pills in college libraries right now waiting to be sold for people to get ready for finals. And those could look like Adderall, they could look like Xanax, they could look like Percocet. Just opening up those lines of communication, sharing the resources that are available, trying to help people reduce stigma as much as possible, using the appropriate language when we talk about addiction, advocating for systems change. So paying attention to what's in the state legislature, for example. And I'll just give one example of that. So last week, the CDC announced that federal grant money could be used to purchase fentanyl test strips. And fentanyl test strips would be used by someone who is using drugs and wants to know if their cocaine contains fentanyl or their methamphetamine contains fentanyl. And the federal government has done that because of what we've seen with this increase in fentanyl-associated deaths. But in Alabama, it is illegal to possess or distribute fentanyl test strips. And so we're advocating for a change in the drug paraphernalia law that will allow individuals to, allow agencies to purchase fentanyl test strips with their federal grant dollars and allow individuals to possess them, allow agencies like ours to dispense them. These are life or death situations. And so really kind of paying attention to things that are in the state legislature that impact those with substance use disorders and being an advocate for us in the community.
And why is it that those test strips are currently illegal here in the state? Is that just something that, is kind of taking its time to be implemented that hasn't been addressed at this point?
Well, it is a part of our drug paraphernalia law, so it would be the same as syringes. And there was a bill introduced in the state legislature last year, but with the shortened legislative session due to the pandemic onset, it just didn't have time to get through. So, and there are lots of legislative priorities, and I certainly don't envy our state legislators in choosing which priorities they address. But these types of things are ways that people in the community can help advance, these so fentanyl test strips are a life-saving measure.
Absolutely. And again, you guys jump in with questions if anyone has questions based on this PowerPoint presentation. And again, this video will be on demand as well for you to go back and reference. Ashley Loftus had presented to us a question, I guess, prior to this, that she had brought up a great point. So when you look at that map that you had with the increase in fentanyl, and then there was a decrease in some states that included North Carolina as well as North Dakota and Montana, seeing a decrease in overdose deaths. What do you believe the reason to be in those states? If you can pinpoint any specific area or trend there that could, have helped that decrease.
North Carolina has been very proactive. So if you have a chance and you want to dig more into there, you can actually Google the North Carolina Opioid Action Plan. So they have had a very sound action plan, and they had a goal of reducing overdose deaths by 2021, and they've done that. And that material is all available out there for people to review, but it was an extensive plan and they've worked it really well. We have a plan here too, and the Alabama Opioid Overdose and Addiction Council is working that plan. I think we had the decreases that you had seen in 2018 in terms of overdose deaths reflected that, and then unfortunately the pandemic. But there are really good things going on here, and I would love to see us be one of those light blue states very soon. In Montana and North Dakota, their numbers are very small anyway. Those are very smaller population states, more rural areas, and this has not been as big of an issue in those states. And we also know that these numbers that we produce were reported deaths, so there is a possibility that there's a data lag in data coming in from those states.
Understood. Yeah, that makes a lot of sense. And to your point, as we all work together to try and decrease the numbers that we're seeing in this space, and obviously the current trends, part of that being the pandemic, Explain to people, what it is, obviously, that this has been a trend that we've seen for years over years, and we've seen an increase in this, it is, I guess, maybe pinpoint some specific areas as to why we've seen an increase in drug use, and especially with fentanyl in recent years, and why this is something that has just become so prominent in our culture and our society. And really, the fact that this is everywhere. Nobody can be discriminated from this. We're seeing it in every community. Obviously, you're referencing specifically the numbers in Jefferson County. We're seeing this all over the state of Alabama, the increase and the usage of this. And maybe you can just shed some light on that, and why you think that in maybe even the last decade that we've really seen an uptick in these overdose deaths, to kind of help for us to comprehend and understand why this has become such a growing issue that has been hard to stop.
Well, unfortunately, most individuals that develop opioid addiction, so speaking of opioid use disorder specifically, start with prescription opioids. So we know that some individuals are more at risk for, addiction than others. There's some genetic factors there. There's some environmental factors there. But when someone is given an opioid, a prescription opioid, and given a prescription for, more than 3 days, more than 7 days, if that individual is otherwise at risk of addiction based on their genetics and their environmental factors, then that can be all it takes to develop an opioid use disorder. So we strike this delicate balance between adequately treating pain and trying to avoid creating opioid use disorder from the treatment of pain. And I think that's what we saw, Alabama prescribed, or dispensed would be a better way to say it, dispensed more opioids and still dispenses more opioids than any other state in the country. Our prescribing rate, or dispensing rate rather, for opioids in 2012 was about 143.8 opioid prescriptions for every 100 people. Now that number is down to the low 80s per 100 people in 2019, which is the most recent year that data is available, but we're still the highest opioid dispensing state in the country. So there's, again, that delicate balance that we try to strike between making sure that people who have legitimate pain receive humane treatment for that pain, but not using opioids when they're not absolutely necessary, to try to avoid patients becoming, addicted to them when that wasn't the initial plan, of course. But that certainly has contributed to the situation here in Alabama.
Yeah, and I want to take that another step and sort of another layer underneath all of that. You talk about the stigma being a big reason for why, we're facing this uphill battle. People feel so stigmatized, they're afraid to ask for help. How can you explain to people, in essence, that this is an illness, that this is something that is treatable, and you talk about hope, and you talk about this is something that impacts all of us in one way or another. We are all impacted by that. So what are some things you can share on that this is, very much a prevalent thing in all communities, amongst all people, and that it is an illness and it is treatable?
So first, I would say that there is no ethnicity or socioeconomic status discrimination from this problem. So we see this problem in, inner city, over the mountain, rural, urban, suburban. In our county and in our state, no one is immune. So I would say that first of all. Secondly, I've talked a lot about chemistry today with fentanyl, and this is a chemistry problem in the brain. So there are opioid receptors in the brain, and when those opioid receptors are activated by a chemical agent like a pain medication or an illicit opioid, the brain actually creates new receptors. And so this is a chemistry issue in the brain. And if you really think about it from that perspective, you'll see that there is a behavioral component, clearly, but there is actually a chemistry problem in the brain. And that's the same as, if someone has diabetes, there's a chemistry problem with the endocrine system, with the way the body secretes insulin or uses insulin. And so this is a chemistry problem in the brain, and we have to get to the point where we recognize that for what it is, and we treat it that way, both in how we approach people who have it and how we medically treat it as well.
And lastly, as we kind of wrap things up, I do want to talk more specifically about the End Heroin BHAM walk and how we're doing things a little differently. But before we wrap up with you, Dr. Traffanstedt, I do want to ask you, you talk about the hope layer, you talk about how people can get that help. What are some trends that you're seeing in terms of maybe people reaching out for help in recent years and people actually taking that next step and saying, okay, I'm going to get control of this? Because obviously we see the statistics, we see the upward growing trends, but are we seeing a positive trend in the way of people actually reaching out and getting the help that they need?
So I don't have exact numbers because the 24/7 helpline is overseen by the Alabama Department of Mental Health. But what I do know is that they have added staff to handle the call volume that 24/7 helpline has seen. And so certainly with, the mental health impact and the financial impact of the pandemic, there are many individuals who have co-occurring mental health issues along with their substance use issues. And so we know that there have been more people reaching out for help through the 24/7 helpline, which is really encouraging.
Yeah, very encouraging there. Now, again, we have the End Heroin BHAM walk coming up, but this year it is not a walk, y'all. We are going to be doing a challenge 16.6, which is the rate of death by overdose in the state of Alabama. So we are trying to bring awareness to that as we have in the last several years. And instead of this being a walk around Veterans Park or Railroad Park, this is a challenge that we're encouraging everyone to get involved in. 16.6. So that number can sound a little daunting, right? Quite a bit. It depends on what direction you decide to go with that, right? So 16.6, you can either run it, you can walk it, you can bike it, you can hike it, you can swim it. And oh, by the way, you don't have to do it all in one day. So we're encouraging people to get together. I know I've talked with my trainer at my gym, and we've put together a team. So we're going to do some sort of relay out at the track that involves the number 16. I imagine it's going to be grueling. We shall see. It should be fun though. But you can register for that. The registration link is in the chat function there for the 16.6 challenge. So this year is going to be a little bit different, but we would love for you all to register. Only $25 to register. You'll get a t-shirt, a packet, lots of goodies in there as well. And again, supporting a great cause as we bring awareness to this. I know that this means so much to people, and being able to have that support. And one thing in talking to our just different people around the community, and our chairman of the board, Shantae Owens at the Addiction Prevention Coalition, shared a wonderful story with us about the meaning and significance of the sobriety chips that are typically given out at the End Heroin walk. And it is just amazing to see how important that little object can be to people, to say they accomplished something, they did something. And I think that we can all reciprocate that by getting involved, by showing people around us that we're all in this together, whether or not you know someone that is impacted by addiction, whether you're the individual that is dealing with substance use disorder, or have a loved one or a family member, or you just want to stand, lock arms, arm in arm, and let people know there is no shame, there is no stigma involved with this. We want to encourage people to get out and get help. And Dr. T, I'll just ask you any final thoughts, any final takeaways that you hope people can take from this and, use to hopefully remove the stigma, and of course take the current trends that we're seeing on the uptick. We hope to see those start to decline here in the near future.
Yeah, I think the takeaway is that you can help us save lives, and we need you to help us, and we need our partners like the wonderful Addiction Prevention Coalition and the work that they do in the community. So get Narcan, even if you don't think you would be in a position to need it. Encourage anyone in your life that uses substances that might contain fentanyl to get Narcan, to not use alone, and to access these free treatment and recovery resources that we have available.
And one more time, let people know where they can receive and get that Narcan at.
Sure, www.jcdh.org/naloxone.
Awesome. Thank you so much, Dr. T. We so appreciate the insight. We appreciate all of you for joining us today. Just some wonderful information, a great way to kind of kick things off, especially this month as we bring awareness to the opioid crisis and the epidemic that is on the heels of this pandemic. So it's certainly been an informative session. We appreciate all of you all for watching, for tuning in. Please feel free to share this to your social media. We'll have the replay of this. So share this with your family, friends, your network of people. Such great information. And of course, we'll have more to come. So go to the website, sign up forefront for updates, and you can join us for these webinars that we host, very often. So again, thank you so much for your time, Dr. Traffanstedt, and thank you all for joining us today on this Tuesday. Have a wonderful rest of your week.